Huntington's disease, also known as HD, is a genetic disorder that leads to the deterioration of nerve cells in the brain. This deterioration results in a decline in both physical and mental abilities, which worsen over time. Unfortunately, there is currently no cure for this disease. In some cases, if the symptoms start early in life, it is referred to as juvenile Huntington's disease. When a diagnosis of Huntington's disease is received, it can be overwhelming. However, seeking support from professionals such as social workers, therapists, or support groups can make the journey a bit more manageable. With the guidance of a healthcare team, individuals with Huntington's disease can maintain their independence for many years. Symptoms of Huntington's disease can appear in people as young as children and as old as seniors, but they often first show up in people in their 30s or 40s. The disease slowly damages nerve cells in the brain, affecting the body, mind, and emotions. If symptoms start before age 20, it's known as juvenile Huntington's disease and it may progress more quickly. The symptoms of Huntington's disease can vary greatly from person to person, and stress or excitement can make them worse. Some symptoms, like abnormal movements and weight loss, are more noticeable than others. The symptoms tend to develop in stages. In the early stages, changes may be subtle, allowing the person to keep driving and working with just a little extra help. Common early symptoms include trouble learning new things, mood swings, trouble sleeping, and muscle problems. As the disease progresses, symptoms may interfere more with daily life. People may have trouble speaking or swallowing, and emotional changes may strain relationships. Middle-stage symptoms can include uncontrolled twitching movements, confusion, memory loss, and difficulty walking. In the late stage, people with Huntington's disease need care from others, as they may not be able to walk or speak. Fidgety movements may become severe, and people may experience thoughts of death or dying. In children or teens, Huntington's disease may progress more quickly and cause symptoms like awkward walking, changes in speech, trouble paying attention, and behavior problems. When diagnosing Huntington's disease, family history is an important factor. Your doctor will ask about your medical background and perform a physical exam. If Huntington's disease is suspected, a neurologist will conduct additional tests to assess reflexes, muscle strength, balance, sense of touch, vision, hearing, mood and mental status, memory, reasoning, thinking skills, and speech. Now, let's talk about managing the symptoms of Huntington's disease. There are different ways to help control the symptoms and make daily life easier for those with Huntington's disease. Medications can help control fidgety movements. Your doctor can work closely with you to manage any side effects and to change medications if needed. Some antipsychotic drugs have a side effect that controls movement and have been helpful for some people. Antidepressants can also help with obsessive-compulsive disorder. Mood-stabilizing drugs can ease symptoms of mood disorders but may cause other side effects. Speech or language therapy may be helpful for any problems with speech or swallowing. Occupational or physical therapy may help you learn how to better control movements. And assistive devices such as handrails can help you manage your changing physical abilities. Nutritional support ranges from using special utensils to focusing on nutrient-dense foods to supplementing with tube feeding in later stages. Exercise may be very helpful. People with Huntington's who stay as fit and active as they can seem to do better than those who do not. Psychotherapy can teach you ways to manage changes in your emotions and how you think. Strategies like breaking tasks into simpler steps may go a long way toward making these changes a bit easier for you and your family. Family members can help by making some changes at home. Serve extra meals and add high-calorie supplements to help you stay at a healthy weight. Limit distractions during meal times. Choose foods that are easier to chew and swallow. Use forks and other utensils made for people with limited motor skills. Use covered cups with straws or drinking spouts. Keep a regular routine. Use phone or computer reminders for tasks. Keep life as calm, simple, and low stress as possible. For children, work with the school counselor to make an education plan. See friends and maintain social interactions as much as possible. Add wheelchair ramps and elevators to the home if possible. Add safety bars in bathrooms, next to the bed, and on stairs. Use voice-controlled lights and other smart home features. Use electronic speech programs or picture charts to aid communication. The gene that causes Huntington's was discovered in 1993. It is present in everyone, but in some families, an abnormal copy of the gene is passed from parent to child, giving the child a 50% chance of developing the disease. Men and women have an equal likelihood of inheriting the abnormal gene, and if you do not have the abnormal gene, you cannot get Huntington's or pass it on to your children. The disease also does not skip generations. If you or your family members are considering being tested for Huntington's, it's a good idea to seek professional genetic counseling first. Counselors can help explain what to expect from the test results. With knowledge about the HD gene, scientists have learned a lot about how the disease affects the brain, and this discovery may help pave the way for future treatment.